Hi, I'm Katie, and I'm a first year doctoral student at the University of South Alabama in the Combined Integrated Clinical Counseling Psychology doctoral program. And together with my colleagues Angelia Davis, Dr. Kimberly Zlomke, and Dr. Sharon Free, we studied the importance of family connection for healthy weight behaviors amidst adverse family experiences and behavioral difficulties. Adverse family experiences are a specific subset of adverse childhood experiences that are related to family related adverse events. So, adverse family experiences are associated with higher risk of overweight and obesity, and also physical inactivity and sleep disturbances among children. Healthy weight behaviors are identified by the American Academy of Pediatrics as empirically based behaviors that impact overweight and obesity. And family connection includes families engaging in activities together, communicating, and working together to solve problems. And similar concepts, such as family functioning, have been related to increased physical activity and sleep durations. Behavioral difficulties are negatively associated with familial closeness and positively associated with increased exposure to ACEs. Behavioral difficulties can often result in higher levels of familial stress, which could place the child at even greater risk for adverse family experiences. We hypothesized that adverse family experiences would be related to healthy weight behaviors, and this relationship would be mediated by family connection, controlling for child age, race, and sex. Further, we extended this mediation model and hypothesized that behavioral difficulties would moderate each path of this mediation model. Utilizing the National Survey of Children's Health, we obtained approximately 14,000 caregivers of a child 6 to 17 years of age. Most of our caregivers identified as female and reported on male children, and most of our sample identified as Caucasian. To measure family connection, we included 5 items of families having meals together, talking and working about problems, working together to solve problems, sharing ideas together, and participating in child events. This sum total ranged from 5 to 20. Adverse family experiences included parents getting divorced or separated, having a parent that has died, served time in jail, a child witnessing some forms of physical violence, and a child living with anybody who has been mentally ill or somebody that has a drug or alcohol problem. Behavioral difficulties was measured using 1 item, asking if a healthcare provider has ever told you if your child has a behavior or conduct problem. And healthy weight behaviors was summed based on the average amount that a child spent either sleeping or on electronic devices, and the average number of days that a child spent having at least 60 minutes of physical activity. And what we found was each model explained a significant yet small portion of the variance. Each mediation model, family connection, partially mediated the relationship from adverse family experiences to each healthy weight behavior. And interestingly, behavioral difficulties significantly moderated the direct effect for both physical activity and screen time. So the relationship was significant for children without behavioral difficulties for the physical activity model, and the relationship was stronger for children without behavioral difficulties for the screen time model. Exposure to adverse family experiences were associated with decreased physical activity and sleep and increased screen time. The family connection mediation model explained a small yet significant amount of variance for healthy weight behaviors. And for children without behavioral difficulties, adverse family experiences was a stronger predictor for adequate physical activity and decreased screen time. Interestingly, the interactions between family connection and healthy weight behaviors for children with behavioral difficulties was not significant. And if you'd like to learn more, please read our paper or you can email me or visit our lab's website.